Hey everyone, in this video, the first in a series of videos I will be doing exploring some of the major mental health disorders, I'll be taking a look at the most diagnosed type of mental illnesses worldwide, and those are, not surprisingly, anxiety disorders. There are numerous types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, separation anxiety disorder, and others. But in this video, I will be focusing on generalized anxiety disorder, perhaps the most widely diagnosed one. In 2019, 301 million people worldwide were living with it, and probably many more who haven't been diagnosed. Now let's take a look at the definition, causes, symptoms, treatments, and lifestyle changes which can help in this overview of general anxiety disorder. We all worry from time to time, but people with generalized anxiety disorder worry about a lot of different things all the time, sometimes for months on end. The condition has its basis in not being able to control a general fear of things getting worse concerning things we all have to deal with every day, including money, health, family, work, and many other issues. Most of us have the ability to limit the amount of stress caused by these things and deal with them appropriately. People with this disorder don't. The symptoms include feeling restless, irritable, or on edge, feeling a sense of danger, impending panic or doom, overthinking plans and solutions to all worst-case scenarios, fatigue, increased heart rate, perceiving situations as threatening even when they aren't, having headaches, muscle aches, stomach aches, and other unexplained pain, breathing rapidly, sweating or trembling, difficulty concentrating, having sleep problems such as trouble falling or staying asleep, difficulty handling uncertainty, and indecisiveness. Before we move to the causes of general anxiety disorder, to everyone suffering with this, I know exactly how you feel, because I suffer from it myself, as well as a couple of other disorders, and it is often, though not always, the case that there are coexisting disorders that go along with it. I have and do experience many of these symptoms, sometimes on a daily basis, and they can be very debilitating, but there are successful treatments, which I will discuss after the next section, which is about the causes of the disorder. Like all mental disorders, there are many factors which can contribute to the development of this disorder, including biological ones such as genetic susceptibility, brain chemistry and abnormalities, and psychological and environmental ones, including negative and traumatic experiences, including, but not exclusively, ones from childhood. Luckily, the number of common treatments for generalized anxiety isn't a lot, but they all have a high rate of success, especially when used concurrently. They basically fall into three categories: medication, therapy, and lifestyle changes. Medications most frequently used are antidepressants, such as SSRIs, which can also be very effective for anxiety, and anti-anxiety medications such as benzodiazepines, buspirone, and beta blockers. If you think you or a loved one may have this disorder, this is your first line of defense. Go to your doctor, tell them your symptoms, and tell them that you would like to try one of these medicines. But be very careful with benzodiazepines. They are very powerful and can be addictive, and therefore are usually used short-term for the most serious cases. Secondly is therapy. There are two main types of therapy used for generalized anxiety, of which the first is cognitive behavioral therapy, which can bring serious relief in as little time as 6 weeks and teaches sufferers different ways of thinking about, reacting to, and behaving in dealing with stressful thoughts and situations. It is the most widely used type as it is the most studied. The second is acceptance and commitment therapy, which uses methods such as mindfulness and goal setting and is worth trying, especially if you can't find a cognitive behavioral therapist, which brings me to my next point, which is the problem of finding one. Therapists who primarily use cognitive behavioral therapy are not always easy to find, especially in smaller towns and rural areas, as most community mental health clinics seem to focus on general therapy practice rather than a specialty one. General therapy can help generalized anxiety, but specific therapies such as the ones I mentioned are the most effective. And of course, insurance is a whole other problem. If you can't find practitioners practicing these specific therapies, there are many self-help books available to buy on Amazon that give you the same techniques to do it without the need for a therapist. Though for most people, a therapist is preferred, but these books can be life-changing as well, especially if you don't have access to specialized therapists. The one I use, and my favorite one, is titled Cognitive Behavioral Therapy Made Simple, for the very reason that it is simple to follow and guide you through the exercises in an easy-to-understand way. Lifestyle changes that can help anxiety a lot are exercise, especially aerobic exercise, mindfulness meditation, yoga, and relaxation and stress reduction techniques. These are all worth looking into. I will leave multiple helpful links in the description covering these treatments and lifestyle changes. To summarize, generalized anxiety disorder is a debilitating disorder with symptoms that are a result of fear and worry about a variety of things in sufferers' lives. The causes are both biological and psychological, and the treatments have a high degree of success. Thanks for watching. Please like, comment, subscribe, and hit that notification bell if this video was helpful for you, and to be notified whenever I release new videos. Thank you, friends. Bye for now.